What is up? Welcome back to my YouTube channel. Today we're going to be talking about thermoregulation, and it's just going to be a quick review. I'm just going to go over key points, things that I forgot, things to remember. Okay, let's start out with some anatomy. So the hypothalamus regulates temperature in your body. So it regulates your temperature, it regulates the sleep. I'm sure you've heard of the air conditioning homeostatic analogy, where you think of the hypothalamus as a thermostat. So when it gets too hot, it works on dropping it, and if it gets too cold, it works on raising it up. And that's basically how you regulate temperature in the body. And there's a bunch of different mechanisms that the hypothalamus will, like sweating, like you're running, you get really hot, your body's hypothalamus releases signals to tell your body to sweat so you can cool off. And it's basically just a regulatory process to maintain homeostasis. When you are too cold, your skeletal muscles will contract, causing shivering. Blood vessels constrict, heat is trapped in deeper tissues. So these are all just mechanisms to maintain homeostasis, maintain a normal body temperature. And why is a normal body temperature important? Well, everything has a certain temperature to live. So you have all these bacteria on your body. These normal flora, things that are good for you, survive in a certain temperature, and your body tries to keep that temperature because it's helpful. Okay, another thing to remember is, yes, your brain is regulating the heat production in your body, or it's regulating when to cool your body down, when to get hot. However, your metabolism is responsible for heat production. Metabolism increases your heat production. There's more heat produced, and if your metabolism slows down, less heat is produced. I see this a lot with people who lose weight. When you're in a calorie deficit and you're not maintaining the amount of calories you need to live, you tend to see a lot of people being really cold all the time, and that's just a factor. So if you guys ever want to lose weight, it's part of it. Okay, let's go right into the exemplars. The first one is hyperthermia, which is an increase in body temperature related to the inability of the body to promote heat loss or decrease heat production. Basically, the body is too hot. And this is not just I have a fever, I'm sick, I have a fever. This is your bodies cannot lower your body temperature, so you have to do all these different interventions to try to get that body temperature lower. Risk factor to get hyperthermia is prior reaction to anesthesia. Anesthesia is so big when talking about hyperthermia. This is, I think, the number one issue with it. A family history and alcoholism are also part of it. Also, I did not specify this, but we're talking about malignant hypothermia. So the primary cause is a genetic defect in calcium transport in skeletal muscles triggered by anesthesia. Hello. Okay, so you're in anesthesia and you're going through surgery, and you notice that the patient's temperature is going too high, and you think that they have malignant hypothermia. Now, what is the priority action? What is the first thing you're going to do? Administer dantrolene. Administer dantrolene. That is the number one priority. You're going to administer dantrolene. You're going to call the HCP, and you're going to give oxygen and initiate cooling. Now we're going to go into hypothermia, which is the opposite of hyper. Your body is too cold and it's having a hard time generating heat. Symptoms include uncontrolled shivering, your blood pressure, heart rate, respiratory rate are all going to decrease, your loss of level of consciousness, and it's going to fall below 93 degrees Fahrenheit for your temperature. Okay, so what is the priority for this disorder? So you're actually going to want to remove all wet clothing. You're going to put blankets, heating devices on them, active rewarming. You can give warm IV bolus to warm them up. Also, attach a cardiac monitor and anticipate defibrillation, because your heart isn't working as much. It's slowing down, and getting them on a heart monitor is very important. Okay, and then also babies can't shiver, so they rely on their brown fat to provide warmth. It's for themselves. So just remember, babies can't shiver. Okay, moving on to frostbite, which is an extreme hypothermia, but it's really only localized to one area of the body. It actually forms ice crystals inside the cells, so it is really bad. You're gonna see this commonly in the ears, the nose, the tips of things, the fingers, the toes. It might become pale, waxy, blue. I'll show a picture. You might see necrosis of a bunch of black on the ear. Okay, key interventions of frostbite include taking off wet clothing, which I had previously stated earlier. No occlusive dressing. Take off anything that is tight. No heavy blankets, no massaging. Elevate after rewarming, so that way your risk for edema goes down. Warm water soaks are very important. I think I had a question on this, warm water soaks. And last but not least, we're going to talk about reyes syndrome. So reyes syndrome it causes swelling to the liver and the brain, and it's most kids are most at risk because of the influenza, and then also because of aspirin. That's why we don't want to give kids aspirin, because that increases the risk of the reyes syndrome. It also causes seizures. The primary intervention for reyes syndrome is administer mannitol. It is going to decrease the ICP, because when somebody has reyes syndrome and they have a lot of pressure in their brain, it's going to increase the ICP. We see this a lot with glaucoma too. You do the same thing. You administer dantrolene with closed to decrease the aqueous humor production, and it's going to decrease the ICP. So intervention, you're going to monitor the ICP, making sure that it's under a certain level. Seizure precautions, you're going to administer vitamin K to help clot, because aspirin is a blood thinner. So administering vitamin K, clot, it's going to help clot the blood. Okay, so this one's a lot quicker than my other video, so I think we're going to have time to go into practice questions. I really just wanted to get the main points out. There's a lot of radiation, conduction, but I think those are kind of easy concepts, so yeah. Okay, so what is the priority nursing intervention for a nurse caring for a premature infant born at 32 weeks gestation? 1. Provide a neutral thermal environment. 2. Promote bonding between infants and parents. 3. Teach parents regarding newborn care. And 4. Administer immunizations to the newborn. I'll give you time to answer. Pause it. Okay, so let's go over the answers. So provide a neutral thermal environment. So yes, we want to provide a neutral thermal environment. So what did I say earlier about babies is that they don't shiver, so they have the brown fat, and they have a large surface area in proportion to their body weight. That's important. And so they're at a significant risk for heat loss. So providing a neutral thermal environment is very, very important. Okay, and then promote bonding between infants and parents. So we're talking about the priority. So we're talking about the number one, the first thing that you're going to do, and promote bonding between infants and parents. Although that's important, that's not the first thing that we're going to worry about. Okay, teach parents regarding newborn care. Yes, teaching is important. Again, not the first thing. And then administer immunizations to the newborn. No, we don't administer immunizations normally to newborns. We normally wait a few weeks to give immunizations, so that cannot be the right answer. So the answer is 1. Okay, the nurse is caring for a patient in the post-anesthesia care unit, PACU, with a history of malignant hyperthermia. The nurse notifies the anesthesiologist with which symptom? 1. Increased end-tidal carbon dioxide levels. 2. Temperature of 99.2 degrees Fahrenheit. 3. Respiratory rate of 10 breaths per minute. Or 4. Oxygen saturation of 100%. Pause it. Okay, let's go over it. So 1. Increase end-tidal carbon dioxide levels. Okay, so this does happen, and I will explain it in a second. Temperature of 99.2 degrees Fahrenheit. Although that's a high temperature, that's not a super high temperature. So having a high temperature doesn't warrant, I have malignant hyperthermia. There could be other causes. Respiratory rate of 10 breaths per minute. So this all gets very tricky because yes, respiratory rate of 10 breaths per minute is important, but also think about what's going on. So they're on opioids. So we're asking about malignant hyperthermia. Respiratory rate of 10 breaths per minute could indicate that they're on opioids, and opioids cause respiratory depression, which isn't a malignant hyperthermia symptom. Does that make sense? So if the respiratory rate was low, this wouldn't be an indication of malignant hypothermia, it'd be an indication of other things. Oxygen saturation of 100%, so that's a good thing. We want the oxygen saturation to be 100%. So the answer is 1, and I didn't really go into this during the video, but let's think about malignant hyperthermia is. So it's triggered by general anesthesics and neuromuscular blockers. Blockers, yeah. So it causes severe muscle contractions, a rapid increase of body temperature, tachycardia, muscle rigidity, tachypnea. So when the muscles contract uncontrollably because of the excess calcium inside the cells, it's going to use a ton of ATP, which burns through oxygen and produces a ton of carbon dioxide. So the first, one of the most earliest signs that you're going to see for malignant hyperthermia is an increase in tidal carbon dioxide level, even before like the temperature goes up. So that's an early sign. I didn't put it in the video, but now we know. A nurse is providing initial care for an adult client brought to an emergency department after prolonged exposure to cold weather. The client is showing signs of hypothermia. Based on the sources, which nursing intervention should be a priority in the initial care of this client? 1. Administer warm IV fluids. 2. Initiate continuous cardiac monitoring. Remove the client's wet clothing. And 4. Encourage the client to drink warm, high carb beverages. All right, I'll give you some time to answer. Okay, let's go over it. So, administer warm IV fluids. Yes, this is important. I listed the interventions earlier in the video, and this is one of the interventions that you're going to do. Is it the first thing you're going to do? You see a client, he's coming, he's wet, he's dying of coldness, and that's not going to be the first. I'm not just going to see him in his wet clothes and I'm just going to stick an IV in him. It's important, but what's the first thing? You're going to remove the client's wet clothing. So don't get tripped up because yes, initiate continuous cardiac monitoring is important. What do we know? We're looking for defibrillation in the heart. So yes, that's important. But the first thing you're going to do is remove the wet clothing. And yes, we're going to encourage the client to drink warm beverages, but first thing. Okay, a nurse is implementing active external warming measures such as heated blankets or warm packs for the client with hypothermia as outlined in the sources based on the information provided, which is a crucial nursing responsibility during the application of these warming devices. 1. Ensure the client is shivering vigorously to aid in heat production. 2. Avoid repositioning the client to maintain consistent contact with the warming devices. And 3. Regularly assess the skin for signs of burns and tissue injury. And 4. Immediately discontinue warming if the client's heart rate increases. I'll give you some time to answer. Okay, let's go over it. So, ensure the client is shivering rigorously to aid in heat production. I think the key word in this is vigorously. Anything that you have an extreme word like that, or easily, or any sort of just extreme word, it's not the answer. Another thing too is like, you don't want the client shivering. That just means that their body's overcompensating for the fact that they're cold, and that means that they're still cold. The heating devices aren't necessarily working yet. Avoid repositioning never avoid repositioning. Come on, when is that ever going to be the answer? Hey, so don't move your client at all. And it says maintain consistent contact with warming devices. But see, that's the thing, is there's a time limit for warming devices. So it's like 10 to 15 minutes for each area. You don't want to overheat it. You don't want to burn the client, So that's definitely not the right answer. Regularly assess the client's skin for signs of burns and tissue injury. Yes. So another key word is literally assess. When you see assess, 9 times out of 10, that is going to be the answer. Especially when it's talking about first priority, you're always going to assess. Assessing could be looking at the client. Assessing could be vital signs. There's so many different wordings that mean assess, but obviously, especially if we're putting heat on the client, you're going to assess for burns and tissue injury. And then 4, immediately discontinue warming if the client's heart rate increases. No. So if you have hyperthermia, your heart is going to decrease. Like everything is going to get lower. So if we're seeing an increase in the heart rate, that's a good thing. They're getting back to a normal way. Okay, so obviously the answer is 3, and that's all the questions we have time for. So thank you. Hope you learned something.